Perfect. And we are now recording. Welcome officially to all of you. Thanks so much for being here for today's training, entitled Assessing and Evaluating Policy Systems and Environmental Change Progress and Impact Across Diverse Initiatives. I'm going to say it one more time because it's a lengthy title. Assessing and Evaluating Policy Systems and Environmental Change Progress and Impact Across Diverse Initiatives. You might hear PSE, policy systems environmental change, abbreviated a bunch. So PSE change, you'll hear a bunch throughout this training. And this is a free training offered through the Community Health Training Initiative and funded by the Massachusetts Department of Public Health. It's brought to you in partnership between DPH and Health Resources in Action. And we're so excited for today's content, which is prepared by some of our colleagues in the research and evaluation team, also in HRIA. We have Hannah Carliner, Stephanie Walker, and Ariel Slifka here. So very excited for them to share about some work they've been doing in the evaluation and assessment space. And we hope you leave today's training with a better understanding of the value of evaluating PSE change and different initiatives, and excited by some new qualitative and quantitative tools that they're going to talk to us about that they've developed recently. For anyone who has to leave the training early today, we would really appreciate it if you could message Victoria to ask for the link to our quick feedback form. It's really helpful for us to hear if our trainings were useful to you, if there are other topics you want to hear about, and to just generally help us strengthen our programming and ensure that our trainings meet your needs. So please ask Victoria for that link if you need to leave early. And thank you all in advance for your presence, your engagement, and for being with us today. We're very excited. So without further ado, I'm going to pass it over to Hannah to jump into the official training.
Thanks. Hi, everyone. We're so glad you can be here with us today. I'm going to start sharing my screen. I'm Hannah Carliner. I am a director in the Research and Evaluation Department at HRIA. And I am here with a couple of my colleagues who will be joining or speaking later. So I'm going to jump into the agenda. We're going to start with an overview of policy systems and environmental change work, and then talk about why it's important to be able to measure and evaluate it. We're then going to present you 3 tools for measuring PSE change that we've been working on at HRIA, Health Resources in Action. These are all still works in progress, and so we really welcome your questions and feedback during this session. We're going to take some time for breakout groups to discuss what we've talked about in terms of evaluating PSE change broadly, and also how these tools may be applicable to the work that you all are doing. We'll then come back for a full group discussion before closing out. So if you are planning on being off camera for now, please just try to turn on your videos around 1:15 when we'll move into small groups. Okay, so before we begin, we just wanted to review some group agreements for this session. We ask that you please be present and engaged, including taking space and making space as appropriate. Be aware of the intention of what other people are saying, and also take care of impact. Speak and listen from the heart. You probably have seen some of these before. Our learning objectives for today are to understand the value of evaluating PSE change initiatives, to learn about quantitative and qualitative tools that can be used to evaluate PSE change, and also serve as self-assessment or planning frameworks for organizations or coalitions. And then finally, to discuss how these tools may be adapted to different situations and contexts with examples from your own work. I'm joined today by my colleagues, Ariel Slifka and Stephanie Walker from Health Resources in Action. Megan Gupta is unfortunately not able to join us today. Very briefly, for those of you who don't know us, Health Resources in Action is a nonprofit organization working to improve and reimagine public health. We always seek to create actionable solutions to social challenges, guided by health and racial equity principles. So I'll start by talking about uh, in order to start talking about PSE change evaluation, we first need shared understanding of what we mean by PSE change. So, PSE change strategies aim to make sustainable, lasting change. So, these strategies create or change infrastructure and modify the contexts in which people live in order to improve community conditions that promote health. So while these definitions are not rigid, we want to provide some examples of what the difference between the PS and E are. So an example of policy change would be working to change local zoning ordinances for corner stores. An example of systems change would be establishing rules and guidelines within planning work that meet age-friendly community designations. And an example of an environmental change would be incorporating pedestrian and bike-friendly policies into community design and planning work. This slide shows a comparison of some of the characteristics of program work versus PSE change initiatives. So program initiatives tend to be one time, whereas PSE change is ongoing. Program initiatives are more additive, where resulting in short-term behavior change for the specific group of people they're targeting, whereas PSE change initiatives aim to be foundational over longer time periods and hopefully longer term behavioral change. Program initiatives tend to focus on the individual level, whereas PSE change sort of takes a step back, working at the community or population level. Program initiatives may not be part of an ongoing plan, where again, PSE change initiatives are more bigger picture and part of ongoing planning and change work. Programs tend to be short-term, PSE change tends to be long-term. Program initiatives aren't necessarily sustaining, whereas the goal of PSE initiatives is to be sustaining by building those foundations. To provide a little more side-by-side comparison, a programmatic approach may be something like connecting people with a case manager to access local housing, whereas the PSE approach would be advocating for changes to zoning and municipal funding regulations in order to increase the availability of affordable housing overall in the community. A program might work to provide local produce to a particular school or school system, whereas a PSE approach might work towards passing statewide policies for permanent funding for local produce delivery to schools. Finally, a program approach might conduct a survey to do the work of capturing community concerns, versus a PSE approach, which might aim to redesign power structures to include those with lived experience in decision-making processes. So you can see that PSE change works again on this bigger picture foundational level, and it's therefore harder to achieve and takes a long time of working with diverse partners. Now, it's obvious, especially in recent weeks and months, that our communities face many urgent, immediate needs. So we are not trying to fault or shame anyone here for the literally life-saving program work that you all and others are currently conducting. But we also know that everyone is working within a reduced funding and funding structure and resource availability in the current climate. And one of the ways to deal with that is to partner together and to look for efficient solutions so that you can pool resources and make the most impact. So we hope that having this discussion and continuing these discussions, spreading throughout our networks, that by working on PSE change initiatives together, we can all work to help set that infrastructure in place for communities to continue mobilizing to address unexpected and immediate concerns that may and will arise. So any questions before I move on to talk about why it's important to measure and evaluate PSE change? Feel free to raise your hand or put something in the chat. So why evaluate PSE change? So, both the doing and the evaluating of PSE change initiatives is challenging. It usually requires long timelines, iterative and pivoting processes, and the ability to account for the influence of external forces like an unexpected global pandemic or the elimination of birthright citizenship in the United States, for example. But demonstrating both the progress and the impact of PSE change work is critical for sustainability, and we think also in order to acquire additional funding for the work. So we want to share with you some tools and hear back from you whether this kind of data can help with both planning PSE change collaborations and obtaining funding sources for new or ongoing work. And together, we hope to show you that evaluating PSE change work helps maintain momentum and motivation while also documenting what is working well and what could be scaled for future initiatives. So part of this session is to help you all think about how you can plan for PSE change and ensure progress as you go. So for example, where do you even begin to plan the steps for PSE change? How do you know if the plan that you develop is comprehensive and set up for success? How do you ensure community engagement and leadership throughout the process? How do you consistently center racial equity and justice in your work? And how do you know and communicate with others that you're making progress towards your long-term PSE goals? Um, so those are all great questions because evaluating and showing PSE change is really hard. As I've said, it requires creative approaches to account for long timelines, iterative processes, and the influence of external forces. And it's also hard because there are really not many tools readily available for documenting processes and measuring impact, as our team found when we were asked to do evaluation of PSE change work. So, over the past couple of years, we have been working to develop some of these tools. These tools are still works in progress because they're all designed to be adaptable to different topics, contexts, and participants. So in the rest of today's session, first, my colleague Ariel Slifka will describe the PSE change approaches report and inventory, lovingly referred to as the PSERE. This tool is primarily quantitative and it helps establish some common metrics to plan initiatives or to evaluate a portfolio of work. Second, I will talk about the Levers of Change tool, which is primarily qualitative and is especially good for documenting collective impact for separate but related projects that are already in progress. And third, my colleague Stephanie Walker will discuss the Reflection and Connection Sessions tool, which collects qualitative data at the same time as it's designed to promote collaboration and communication across a social justice movement while documenting progress towards PSE change. To show you examples of these tools and how they work, we're going to focus on the topic of relationship building, partnership, and community engagement in discussing each of the tools. We hope that keeping this common theme throughout will help you to compare the tools and think about how they might meet your needs and the work that you're doing or planning to do. I am going to stop sharing for a moment and see if there are any questions before we jump into each of these tools. And feel free again to raise your hand or just come off mute. Is anyone currently doing any PSE change work? And how has it been affected over the past year? What's changed? Lisa Goldsmith, are you trying to
Well,
unmute?
no, I wasn't. I was just finishing lunch, but we have been doing a couple of things. I can talk about that, but the second part, I was like stumped. We are trying to do. I work for this SPIFFy Coalition, the Collaborative for Educational Services out in Western Mass. And we are a youth substance misuse prevention coalition. So we've been trying to do some things around alcohol policy to reduce access, et cetera, for young people to reduce use. So that's one thing that we've been doing. And we just had a conversation today, like sorry, I'm in the shadow here. How do we really demonstrate change besides policy change? What are all the things, we're meeting with municipalities about best practices around alcohol policy, but that doesn't show like a big bang, like, wow, we changed the policy, but it's still important. So so that's something that we've been doing. We also were working with a couple of organizations that had we're doing work in schools to change policies and practices in schools, like to create more gender inclusive policies for young people in schools. And under the climate, our current climate, I think schools were a little more hesitant to implement policies. So that's some of the things that we're working on. And this topic is really interesting to sort of demonstrate, like how do we show, like, well, it's great because the organization that we were working with was meeting with all the GSAs and really empowering young people to think about policy change, but it didn't necessarily happen. So anyway, that's
and also you don't necessarily always change the policy. And
right.
That doesn't mean that like 5 years of your hard work was worth nothing.
Right.
So it's like the documenting, yes, change the policy is one way to do it, but that one actually doesn't work if you don't achieve that change.
Right.
So
right.
yeah,
How can you show movement towards? So
yeah, and that you weren't just twiddling your thumbs the past 5 years, that you were working on
exactly.
something.
And we are also doing this under some SAMHSA funding, and that certainly changed their focus.
Right.
And
not to no
we stopped
fault of your
talking
own.
about it. We just stopped talking about it. We said school policy change. We didn't talk about gender inclusive anything. So
yeah. Margaret.
Yeah, thanks. We're also working with youth about to do a project. I mean, with youth, this work takes a long time, but we have them for a limited period of time, which is always a challenge. So trying to build something that kids can jump in and out of is important. But we are also working on alcohol policy change on the state level, and yeah, trying to get from this some evaluative processes that we can implement at the same time to kind of measure what we're doing and how we can do better. Yeah, definitely. Thank you.
Thank you. Anything else from the chat that anyone wants to lift up that I can't see on my too many windows open screens? Rose, go ahead.
Hi. What I put in the chat, and thank you for all of this, Hannah, it's great. What I put in the chat is, as someone who facilitates planning for various groups and entities, there's a real reluctance to even talk about policy and advocacy work right now because of the environment and all of the things that means. And I'll just leave it at that. And the sort of focus on the short term and the immediate, like, what's the result? What's the impact? Show me the result of the money, show me the result of the investment, pulls against kind of really digging in deeply to PSE work, because we want to see results tomorrow, which we know for complex situations is often not possible.
Thank you, Rose.
I will just lift up that what I put in the chat was we struggle with, so we build partnerships. That's like our whole coalition's purpose, right? And we gain partners, and we've expanded many times over in the last several years. But because that's our business, is the convening and the assessment and the collaboration, the result is often seeded with a partner organization, right? The program that gets started, the grant that gets funded, the whatever is often a partner organization that gets to say, we launched a thing and we did something. And like, I don't get to claim that as just because they built that awareness by being part of our organization, part of our coalition over several years, and it would never have even occurred to them to apply for that if they, hadn't been part of. I can't prove that, and I'm not about to like go out there and make an announcement that we did that. So it's a little hard to show like what we do.
Yes. Yeah. Yeah, thank you all for the great examples. And we're hoping some of these tools that we've developed can help, because it's different audiences that you need to prove it to, and it's also like different kinds of data. So maybe a little bit of like quantifying. Some people need to see the numbers, they need to see the percents, but then you also need that story. You also, like, if you're going to say, I formed this many partnerships, we had this many meetings because of it. You also need that example, Chelsea, of like, and because of that, this group who's been a partner since 2013 was able to accomplish this. So you need that sort of mix of data to tell the story. So I am now going to pass it to my colleague Ariel Slifka to discuss our first tool, and I will share my screen again.
Thanks, Hannah. Waiting for the slides to pop up. There they are. And then I think,
Am I the only one that Ariel's voice is very soft for?
oh, sorry, let me pull my, is that better?
That's
Okay,
better.
great. Perfect, thanks, Hannah. Okay, so I'll be going over the PSE Approaches Report and Inventory tool, which is a mixed methods tool for evaluating a range of PSE change initiatives. And just a little bit of background here. This tool was first developed to evaluate the progress and impact of mass chaff, which some of you may be familiar with. I recognize some names in the chat here, but mass chaff is the Massachusetts Community Health and Healthy Aging Funds. The funds are a result of the Massachusetts Determination of Need regulation, which requires that when health systems identify a need to expand or improve facilities or services, they apply to the Department of Public Health for approval, and 5% of the cost of the project must be invested into community health initiatives. And through that, organizations and communities can apply to be awarded multi-year funding for community-centered initiatives that address root causes of inequitable health outcomes. And this is done through community-centered policy systems and environment change approaches. So there are currently 3 cohorts with over 80 awardees across the state of Massachusetts.
If there's anything else you can do to be louder, Ariel, that would be great. But if not, no worries. For anybody who's having trouble hearing her, you can also enable the live captioning at the bottom of your screen, which might help a little bit.
Sorry about that. I'll talk louder. Is that coming through? Okay, I'm seeing some thumbs up. All right, so here are just some examples of PSE change initiatives through the funds themselves. So you can see that there's quite the range, everything from developing online affordable housing search tools to establishing urban agriculture policies. This is a snapshot, but it gives you an idea of the type of work that different communities are doing across the state of Massachusetts. And part of our team's role at HRA is an evaluation of the funds as a whole. So what has been that overarching impact of mass chaff across the state, and how do we create those common metrics that capture the range of health and racial equity work and PSE change that's happening across these initiatives? And so when thinking about that, we ended up utilizing the Water of Systems Change framework, originally developed by FSG. So this framework outlines 6 interdependent conditions that hold a social or environmental problem in place. It arranges these conditions in a triangle shape, the idea being that those at the top are the most visible or tangible to most people. So we're thinking about the policies, the processes, the distribution of resources, And then the layers underneath are less tangible or explicit to most. So these include relationships and connections and power structures. And then at the base of the triangle, we have mental models or community beliefs or narratives, which in this framework is seen as the least tangible or explicit to most people. And it's worth noting that we have an evaluation work group, sorry, Hannah, which is made up of current MassChap awardees. And so they were instrumental in adapting the original framework. So what you're seeing here is a slightly adapted framework. And through this co-development process, we heard overall that this framework aligned with how awardees saw their work, specifically around those less tangible ideas, such as relationship building and power shifting, as these were areas that awardees felt were often undervalued when working on changing institutional and structural barriers. And so it was really important that these were included as significant markers of progress and impact towards health and racial equity and systems change. So once we had that framework, we utilized that to develop an evaluation tool known as the PSE Approaches, Report, and Inventory. So this is a mixed methods tool with both qualitative and quantitative questions for each of the 6 conditions of systems change that we saw on the previous slide. As an example, this is an excerpt from the power shifting section. So each section started off with an open-ended question of, in a sentence or two, how's your initiative working to shift power, followed by specifics to how this is contributing to the advancement of health and racial equity. And then we had some sort of multiple choice list of activities or strategies related to that condition to capture how awardees are doing PSE change work. And then each section ended with a progress matrix to capture what stage of the work they were currently in related to that condition. So this is just kind of a snapshot of one of the 6 sections to get an idea of what these questions looked like. And once we had the tool fully developed in collaboration with the evaluation work group, we provided a toolkit overview with a recorded webinar, office hours, one-on-one technical assistance with awardees to support them in filling out this tool. So we asked each awardee to review the full tool, decide which of those 6 sections were most relevant to their work, and focus on filling out just those in order to alleviate some of the burden of filling out the entire tool. And then after piloting with the evaluation work group, we put together some recommendations for awardees, such as designating a lead, meeting at least once with staff to discuss the different prompts, and collaborating in some sort of shared document to draft responses. And then moving on to some of the example results themselves, as Hannah mentioned, we're focusing specifically on that relationships, connections, and community engagement bucket when it comes to that framework. So looking briefly at some of the results, we can see that across those 6 areas of systems change, a large majority of awardees reported working on the relationships, connections, and community engagement as part of their PSE change initiatives. And we see about half of awardees reported working on that top row, policies, practices, and resource distribution and access to services, and then a little less than half reported on working on power shifting or mental models. And focusing in on the relationships, connections, and community engagement results, this slide shows a bit more detail about the types of partners that are being engaged. So we see high levels of engagement with social service organizations, community members, grassroots coalitions, and less engagement with police and EMS, the private sector, and religious organizations. And it's worth noting that all of these partners may not make sense for each organization. That's not necessarily the goal of quantifying something like this, but it is important to consider who's at the table in areas where it might be valuable to explore more. As one awardee noted in an open-ended section of the PSERE about the importance of relationship building, they mentioned by fostering authentic partnerships across institutions, including policymakers, justice systems, and community organizations, the work creates a shared accountability for addressing structural inequities. And then another data point we wanted to look at was new partnerships. 95% of awardees reported developing new partnerships due to their MassChap funding, and just under 30% of respondents reported adding 6 to 10 additional partnerships, and just under 30 reported developing 20 or more partnerships, which this really resonates with what we've heard from awardees previously, that the community engagement and partnership work is essential to PSE change, but is often under-supported in the field. So it's noteworthy that awardees are taking advantage of the opportunity provided by the funds to focus on building these relationships and partnerships. And to get an idea of what this looks like, one awardee noted about the range and growth in their partnerships that the coalition uses a personalized approach to identify new community partners, reach out strategically, and cultivate connections based on an understanding of mutual beneficial goals.
Can you slow down a little bit?
Oh, yes, sorry. We expanded our partner network to include more houses of worship, local food distribution sites, fitness and wellness centers, 15 area high schools, and a prominent older adult affordable living housing community. And then shifting to community engagement, this is the continuum of community engagement that can be used to get an idea of the level of engagement by communities. So this spectrum starts out with inform, in which community members are solely provided with information and not necessarily involved outside of that, all the way to the other end of the spectrum at community-led, where community members are centered as those full decision makers. And we use the PSCRE to collect some retrospective information about how awardees have furthered their level of engagement. So as you can see in the visual, the top bar is prior to Mass Chaff funding, where the majority of engagement was in that first part of the spectrum, noted in the lighter colors. So at the level of inform or consult or involve. And then you can compare that to the bottom bar, which is the level of engagement of awardees when they had Mass Chaff funding, where engagement has moved further on the continuum into collaborate and empower, with 12.8% of awardees reporting that they have progressed into that further bucket of community-led engagement. And then we'll shift, just closing out here on the benefits and limitations. So the PSE Approaches Report and Inventory tool provides a framework and a tool for evaluating a broad range of PSE initiatives. So it helps make those broad systems change ideas such as relationship building and power shifting more accessible and measurable by providing those common metrics for each area of systems change. This makes it potentially a useful tool for evaluating a portfolio of work or the work across a coalition or a network. And the mixed methods approach with the qualitative and quantitative aspects allows for tracking collective metrics and sharing community stories. It also allows organizations and communities to define their own work, as participants can opt in to complete sections of the PSCRE tool that are most relevant to them, which helps reduce the burden of completing a much longer survey tool or a full written report. And then the quantitative sections provide metrics that may resonate more with certain audiences or be particularly powerful in external communications. And then as for limitations, the PSCRE relies on self-reported data and stories. It may not capture the full impact or nuance of each individual PSC initiative, as it was developed to identify those common metrics across initiatives. This is also a newer tool, so we don't necessarily have results showing replicability across time or initiatives, but it may actually be a tool that's better used as something that's adaptable and flexible and responsive to how PSC change work might change over time. And it's also worth noting that the strength of the link between the metrics and the long-term systems change is unknown and something we'd want to monitor as we continue evaluating PSC change initiatives in the future. Okay, I feel like I've been yelling, but hopefully you all have been able to hear me. From here, I will pass over to Hannah again.
Yeah, Ariel, it's been good yelling. Okay, so moving on, I am going to chat about another tool we have in our toolbox, the Levers of Change tool. So when you think about what initiatives have in their toolbox, they may not be using the tools differently, but there's going to be some overlap in the type of tools that are being used. So maybe one group is using a hammer to remove old nails, and you're using a hammer to break something apart, but we're both using a hammer to make progress on our projects. So a lever of change is used to describe a category of tools and approaches that initiatives are using to advance their PSE change work. So we'll share some examples of ones that we've used in our evaluation in the next few slides. But a common lever that we're going to talk about, as I said, through all three of these tools in our toolkit is community engagement and relationship building. So you may be working with 5 different initiatives that are all utilizing community engagement in different ways and for different reasons, but all 5 are utilizing community engagement methods as part of their approach in some way or another, making community engagement that lever of change that you decide to define across initiatives. And by identifying and measuring or tracking these shared tools through evaluation, we can tell a story about the initiatives that is both unified, but also highlights the individual work that projects are doing. And so this approach also facilitates us identifying what are the factors that facilitate PSE change in different contexts and different project groups. So in identifying levers of change, the process is to sort of work collaboratively with initiatives and or with your team to identify these key facilitators for PSE change work. So one first step would be to ask all groups in the initiative or in the coalition to put together a theory of change or a logic model. And then one person or one group would take, if you're an evaluator, it would be the evaluator. If you're a coalition, it would be whatever backbone organization or lead group would sort of look across these logic models and try to pull out what are the levers, what are the common themes throughout that are the sort of action points. So not the common goals, but the common tools that are being used across. So these tools might not capture everything that initiatives are doing through this levers of change approach, but these can be paired with individual tracking pieces for each initiative. In crosswalking, once you pull together these logic models and start crosswalking the levers, you want to continuously go back to the groups that you're working with to see if it resonates with them, to refine. And it's really like striking the sweet spot of making sure that the lever categories are broad enough that they allow for adaptations and evolutions that initiatives will have to make over time. For example, if an initiative starts with a focus on individual relationships with partners, but grows into doing work in broader coalitions, you want your lever to be able to account for both of those. And so you want to find that sweet spot between like broad enough, but also narrow enough that it's actually defining a concept that people can understand. So you want to ask yourself and the initiatives you're working with these questions of, does your work align with this concept? What specific activities are you working on within this concept? And how can we adapt to this lever to respond to the iterative nature of PSE change? So some further examples of levers of change are community engagement, empowerment, and leadership. So for example, community members or people with lived experience are engaged in different roles in the process itself of the PSE change initiative and decision making. Or relationships, connections, and partnerships that we just talked about. So these partnerships are created and strengthened across sectors or systems to further PSE change. Other examples are evidence for action, so building an accessible and actionable evidence base for furthering understanding of PSE change goals and related issues. We've used this lever of change to capture the evidence that initiatives are building through their PSE change work. So this could be really direct things like the data that they're collecting about an issue or a community through surveys or research study, or it could be the stories that they're collecting or supporting people in telling as part of testimony in front of the state legislature. So how are initiatives and their partners and their communities making the case for PSE change? How are they bringing people on board for their cause? In terms of communication to decision makers, this is the development and implementation of tactics to engage and influence decision makers who can impact PSE change. This is often required. If you want to change a policy, you've got to get up there and talk to the policymakers. And so we found it impactful to be able to tell the story of how initiatives are doing this. And it often intersects with other levers. For example, how are community members involved? How are they using evidence to tell their story? This is just an example of a crosswalk for identifying these levers of change. So let's say through looking through the logic models and discussion and one-on-one interviews with leaders in the different initiatives, you come to community engagement as a potential lever. You can then create this crosswalk to document in these three different initiatives what's an example or what's the type of community engagement working. And then you come up with a communication to decision makers as a potential lever. And again, you crosswalk them here. And this can help you both, as a on your own, figure out, is this really the right definition? Is this really the right term to use to describe these three different methodologies? And then also as a tool to bring back to the larger group and see if the initiatives all agree that this is the right way to describe their work. So an example of this approach, again, going back to this relationships, connections, and partnerships lever, is once you've defined these levers, you can then go out and seek tools to measure them individually. So there are multiple tools out in the world looking at collaboration, partnership, and having different quantitative methods to define those. Quantitative and qualitative. So this is one of those tools where you can go to your different initiatives and have them sort of self-categorize in terms of, are they at a networking phase or a cooperation phase, coordination, coalition, or collaboration? And you can see this tool is something that, as you go across, how are these different activities, how would you rate yourself in these areas? So like in terms of, are you at a networking phase in your partnerships? That means not very little communication. Cooperation, you have formal communications. Coordination, you have weekly or monthly meetings set up to maintain that communication. In coalitions, it's even more well defined than that. And collaboration would be if partners feel that they are having this mutual trust and that they really feel that they are all part of a collaborative. So creating the levers of change helps you find ways to quantify and storytell around the work that you're doing. These are some of the qualitative questions you could also ask with a relationship scale. This would be in like focus groups and interviews. So asking people how the collaboration has been integrated into your systems. Did you have the right partners to move forward? If not, who's missing from the table? So these are just some examples for how you can continue to collect evaluation data once you have established your levers. The benefits of this approach is that it helps describe collective progress towards PSE change across potentially very diverse initiatives. It can also capture incremental and foundational progress. And to some extent, it allows for standardization in evaluation while still highlighting individual stories and successes. Some limitations of the approach are that it can be tempting to compare between initiatives when really the levers should just be used to create a shared narrative. So it's really about the storytelling at the end rather than comparing who's doing the work better. Also, the levers of change won't always match perfectly with how initiatives talk about themselves, but that is the sort of sacrifice that you make to tell a unified story. I am going to take a little break and see if anybody has any questions here before I pass to Stephanie Walker for our next and final section.
May I ask a really broad question?
Yes.
So are most of these evaluation tools, though, are to evaluate the work that the organizations are doing themselves, but not necessarily the impact that the work they're doing has then on the general population?
I would
So it
say
almost seems
yes.
like it's still like higher level, but it's not at a level in which, let's say, the organizations, the people, right? Like when we're more on the on the ground level doing the work to be able to evaluate the impact that the work we are doing also has on the individuals or the communities that we're serving?
I would say yes, and it depends. So, like, for example, um, yeah, a policy change could say that a policy is passed, but it's not necessarily saying how many additional people got housed than were housed before. And so I think part of the reason for that is, I mean, I would love to hear what you're thinking about, but it's nearly impossible to draw a causal relationship between those things. Like, it is very hard to say with everything going on in the world that the one part that you were working on led to decreased maternal mortality in the state of Massachusetts, right? And so, and if you try, I mean, you can sort of say that's the goal that we're working towards, but usually with PSE change, it's so long term and it's so big that people wouldn't necessarily believe you. But I think maybe you're talking about a smaller scale than like maternal mortality in Massachusetts. Not to, sorry to laugh at that serious topic, but it's overwhelming. I'm laughing because it's sort of overwhelming how hard it is to document that you are the initiative that made that statistical change. So yeah, I think we do try to focus more on the process and the intermediate wins. But tell me more what you're thinking.
Yeah, no, I think as I'm thinking of when you're actually trying to get outcomes, right? Because a lot of the times people will ask you, okay, so Uh, if you're thinking about a SUDS intervention, how many people actually got jobs? But then again, it is such a complicated system in which, yeah, someone may get a job placement for, a month and then unfortunately may have a relapse. And then
Yeah.
I think the challenge is that a lot of, let me just speak for myself, a lot of the work that we're doing, we're really trying to justify it all the time. And
Yeah.
sometimes, as important as relationship building is, it doesn't necessarily speak to people who may be funding your projects or people who really just want to see hard data and, without necessarily realizing how complex and so much work that goes into
Yeah.
what each and every single person here, I'm sure, is working on. And so I guess part of what I'm trying to get at is like, are there tools that could give a glimpse or could potentially bridge a little bit more of that lower level? Perhaps not perfectly, but are there tools that we could potentially utilize that are not as burdensome and can be integrated into the work that we do? So that's where I was going with that broad question.
Yeah, no, it's a fantastic question. Other thoughts from my team on that? Yeah, I don't think we are providing that because I think it's very, very hard to provide. And so, I mean, I guess I would love to have conversations in our small groups about how to do that, but I think where we have gotten to is that it everything needs to be a mosaic of data. And so hopefully these tools can give a little bit of quant with a little bit of storytelling of that provides you give one example of increasing access to prenatal care, and then you have one example of someone who, because of that, didn't get preeclampsia and didn't get terribly sick during pregnancy, but you have a very powerful story to show that. And then you also add in epidemiological data. You add in like policy research data that shows in general every dollar spent here leads to XYZ. And so you're sort of using that all together to tell that story, because it is so hard to claim causality in anything that you do, especially when the world is so topsy-turvy. Thank you for that point. I will pass it back to Stephanie, and then let's keep having these discussions in our groups.
Thanks, Hannah. And our last tool that we're going to talk about are reflection and connection sessions. Can everybody hear me okay before we dive in?
Yes.
Thanks. And I hope that this helps add one more piece to the puzzle for that great question that we're just discussing. It's already got so much kind of turning, the wheels turning up here, but definitely I think that's kind of an ongoing struggle. And part of the reason why we focus on PSE change is thinking about the ways that we can change those systems, the ways that we can adapt our policies to reduce those inequities, to reduce the systems that are creating kind of the inequities that we see in health outcome data, for example, with the idea that if we can change some of these pieces now, we'll see those long-term outcomes change later. So all of the tools that we're presenting are really just kind of focusing on, okay, so if PSE change is the goal, what are kind of the steps that we can get, because PSE change in and of itself is absolutely massive topic. Our last session, our last tool that we're going to talk about is reflection and connection sessions, though, which look at a slightly different lens on PSE change. So first we'll dive into the backgrounds and the methods. Next slide, please. Thanks, Hannah. So like the PSE approaches report and inventory that Ariel shared previously, these reflection and connection sessions were developed through the Massachusetts Community Health and Healthy Aging Funds, and were also co-developed through those multiple iterations with the evaluation work group that Ariel described earlier. These sessions were developed primarily to be responsive to grantee requests for connection and networking, which had been a reoccurring theme in our feedback over the years that we'd heard. And they were also designed to capture information and stories about the collective efforts of the entire portfolio of grantees connected through MassChap. So in our work, we focus a lot on stories about individual impact, but we really wanted to challenge ourselves and our partners to think about their stories at different levels. So to think about the story of their initiative and their organization, the story of how they are situated in the field and the role that they are playing and the progress that they have made as part of this larger movement happening in their fields, all while creating space for shared learning and to identify areas for partnership and collaboration, while simultaneously reducing reporting and administrative burden for those grantees. Next slide, please. So what exactly is a reflection and connection session? These are semi-facilitated conversations held with partners and community members that are all working in the same field or space, like housing, like healthy food access, like mental health. These were 90-minute virtual meetings with up to 10 participants, along with a facilitator and a note taker. And I qualify these as semi-facilitated because we did have some core questions in every discussion, but we also used the opportunity to create space for our participants to mention other topics of interest, and to ask each other questions and to share resources. So at the end of our sessions, we, as the facilitators, would then compile the contact information for those who opted in to share it, and any resources that were shared in the chats and the discussions, and any follow-up items. And we would then share that out with the full group by email after the session so that all of the participants who were engaged could continue to build those relationships and follow up on any of those items outside of the session. So overall, these do look similar to a focus group, with the little twist that participants were encouraged to be more engaged in driving the discussion, namely by asking each other questions, lifting up key topics, and really digging into the areas that they wanted to focus on, versus the traditional focus group, which is more structured and more focused on that discussion between the participant and the facilitator, asking those direct questions, and typically less so focused on fostering the interactions between the participants themselves. So this slide just shows a little snippet of a conversation about housing that I wanted to include just to illustrate the types of conversations that we hope to spark through these reflection and connection sessions. So one participant asked, for folks who are organizers, what have those conversations been like for that transfer of resources in housing? With people in white, wealthy, healthy aging communities, are they willing to give up that power? How are you guys having that conversation on the ground? How are you bringing folks with less power into the housing space? So some of the responses that they got to that question from their peers included, I would say that I think at a high level, it is shifting left as much as possible who we are getting feedback from. Including these people in the discussions very on, and also being radically transparent with the data. Is it displayed and available to people with different abilities? Where is affordable housing located? How are those results displayed? We need a thoughtful deconstructing of racial segregation in housing by including individuals that are trusted by those in their own communities. And another participant weighed in terms of talking to folks who have resources, who have power, our campaign focused on the message, we can't afford to lose the people who can't afford to live here. Next slide, please. So as we alluded to previously, the grantees that we partnered with through the MassChaff initiative are doing amazing work across a broad range of topics and sectors. And I know that Ariel also mentioned a couple of examples earlier as well. For our work with the funds, we distilled the work of our grantees into 11 main topics or fields for the purpose of these reflection and connection sessions. So we would organize grantees, we would ask grantees to participate in at least one topic that they were interested in. And we created a sign-up sheet so that grantees could opt into the conversation that they felt was most relevant to their work. And then on the back end, we as the facilitators and the organizers monitored those signups, and we added or condensed groups according to the level of interest and the level of signups that we had. So for this implementation, we limited our invitations to only the grantees that are part of the MassChaff portfolio, but we also feel that this tool could easily be adapted to include additional audiences, such as community members, legislators, religious institutions, and others. And also additional topics could be added based on community need. Next slide, please. So as I mentioned earlier, we considered the reflection and connection sessions to be semi-facilitated. So we did bring a core set of questions that we would like to cover to each session. And we also encouraged participants to share their individual stories, to brainstorm and share resources together, and to ask each other for help with questions and advice. So the core topics that we ask questions about are 1, understanding the field in each topic area. So for example, housing or food justice, healthy aging, including whether there is consensus on how unified or aligned the field is. 2, we asked about progress in the field towards PSE change, including what are the wins and what's working well and why. 3, how is the field advancing health and racial equity? What strategies are helping to address the needs of different groups? And 4, the role of funders. So we asked the grantees to reflect on their role in the field and the strengths that they are bringing. And we also wanted to ask for their insights so that we could learn as a funder about the different opportunities that we had on how we could be engaging in the field and taking on a bigger role for ourselves as well. So for our initiative, we decided that it was best to collect this information every other year. And this gives us the ability to monitor changes over time, while also reducing the participant burden and providing space for complementary data collection efforts, such as the PSERE. Next slide, please. All right, so we're going to dig into some examples focusing on community engagement and relationship building. So when we ask participants questions about who made up the field, they often emphasize the critical role of community members and people with lived experience to drive PSE change. However, participants often remarked that community members are often missing from the important conversations and decision-making spaces. So grantees frequently explained that their efforts around community engagement and organizing were to help center those community voices in the decision-making spaces to advance PSE change. We have a couple of quotes that help illustrate. So 1, the residents who are impacted are a part of the field, but they are not at the table. And we're all community people. We bring that no matter where we're sitting. We can bring that community network into the field. Next slide, please. So similar to the role of engaging community members, grantees saw their role in the field as connectors and conveners, bringing people together to advance the work and make progress on shared goals. In this space, the grantees explained that they are serving as a bridge between community members and decision makers to help amplify those community voices and share information, and also connecting community members to services and supports within the community. So some examples of some quotes in this area. A lot of the work that my organization does comes from relationship building, from 25 years of advocacy and coalition building to build bridges and finding the like-minded in the community. And another shared, our goal is to get people who are affected by the housing crisis involved in the conversation about how that crisis is solved, ensuring that those people have a seat at the table. Next slide, please. So participants explained that coordination and coalitions are two key aspects of their role as conveners and connectors. This includes helping community members navigate complex systems and dynamics, and also helping coordinate with partners and coalitions in the field to align their efforts for a greater impact. So in one quote, we partner with a community-based affordable housing coalition that works with the state on policy issues. Meetings are also used to do a program connection and connecting individuals to resources. It's a micro and a macro thing happening. And historically, it has been hospitals or health departments having these conversations. But I see that Massachusetts is slowly bringing in those non-traditional partners who serve at these populations onto the board to make sure that those gaps are filled. And lastly, we asked participants to explain what their vision was for the future of the field. Participants described transforming systems to be inclusive, to center and empower community leadership, and to ultimately create a world where their efforts, whether it be increasing affordable housing, healthy food access, mental health, where their efforts are no longer needed. It was a common sentiment that participants had a dream and a goal of working themselves out of a job, essentially. So just one more quote. In 5 to 10 years, I hope we don't have to be doing the same kind of work, or at least I hope we won't have to be doing the same kind of work in the same communities. We would love to have the tools ready so that they can go out and build their own coalitions. All right, so next we'll dig into some of the benefits and limitations of this approach. Next slide, please. So based on our experiences and the feedback that we heard from grantees, we identified some benefits to the reflection and connection sessions. First, this approach gives a point-in-time look at the status of the field, and it helps participants to understand how they fit into that big picture. So this was a big shift for us as evaluators because we had previously attempted to synthesize information about each initiative to gain an understanding of what was happening within each field or movement, but we felt like we weren't getting the right information. So through this method, we can bring together key stakeholders so that they can reflect together about the cohesion of the field. This also leads us into our next benefit, that by bringing people together for these conversations, we're naturally creating the environment for networking, for aligning goals, and for building momentum, and for sharing lessons learned. So we often heard from our participants that it can be difficult to come together as a field for these conversations. And when we came in as a funder and we did all the organizing and the support for these conversations, the feedback that we heard was really positive. And we could see all of the connections and sparks happening in real time through each session. And lastly, because this method is fully qualitative, the participant burden was very low. We didn't ask for any preparation from participants, and each conversation was about 90 minutes and virtual. So participants shared with us that they appreciated that this approach, both for the networking and learning aspect, but also they appreciated that it was an innovative way to collect information without those long, burdensome reporting requirements. A couple of quick limitations. One, this approach relies on self-reported data and stories. So while the goal is to capture the big picture story of movement or field, you may be only hearing one side of that story based on who's in the room. And this approach requires strong facilitation to keep the conversation flowing and focused, and to give space for everyone to share during the conversation. And because this approach focuses on the big picture, we decided to forego individual grantee conversations, which do yield really rich stories about the individual PSE initiatives. But we wanted to do our best to capture the story of how each grantee's work is contributing to the broader changes in the field. And we likely aren't capturing the full story in these 90-minute sessions. We also do send out contact information and resources so that grantees can keep up the momentum from these conversations. But that's one other limitation, is that requires follow-up from the individual participants that's outside of our scope of control. And lastly, these sessions have only been utilized as part of our work with the Mass Shaft funds and our kind of efforts to capture the impact of a portfolio of PSE change initiatives. So while we believe this approach could be utilized and adapted to a broad array of PSE change efforts, at this time it's unknown how well this would adapt to other projects or other uses. And lastly, thank you, Hannah. I want to just talk about the participant feedback that we got from this approach very briefly. Because we are evaluators, we did conduct a survey with our grantees about their experience in the sessions. We found that 82% of respondents agreed that they learned more about the work that others are doing. And almost 70% agreed that they feel an increased sense of community within the funds. And I just want to give the grantees a last word on their experiences. One said, "It was an awesome opportunity to elevate our work in a natural exercise within a larger group as opposed to producing a report. We had the chance to listen, engage, learn, and really absorb." Another shared, "It's a really innovative idea and one that plays to the strengths and capacities of grantees. Having to distill our work into what can be a really sterile yearly report doesn't do the work or the team justice. I appreciated having more of a living forum for us to share and measure our work against and with other grantees." So with that, I'm going to pause, take a breath, see if there are any questions before we dig into the next section, which is going to be kind of looking at all of those different approaches across each other.
And the other thing we're going to do is drop a Padlet that we have into the chat. So this is for you all to sort of think about some of what we've all presented to you, reflect on your own opportunities and challenges doing PSE change work, and feel free to, sit with that for a moment, drop in some notes or ideas that you have. We would, as we keep saying, these are all new tools that we're looking to keep adapting and keep seeing how they could fit. So we would really appreciate your feedback in the Padlet. And then also just take some notes and then share here with the group as well. But I think we're dropping that into the chat, and then Stephanie can take other questions if you have them.
Any questions? Feel free to put it in the chat or to raise your hand or come off mute. If not, we've just got a couple more slides before we jump into some breakout discussion. All right, we will jump into the last couple of slides that we have that are looking at the three approaches that we've talked about and thinking through kind of which might be right for the work that you're doing, the PSE change that you're focusing on. So to recap, the PSERE is primarily a quantitative tool with some open-ended questions to collect stories and narrative. It helps to establish a shared understanding of PSE change by standardizing activities and common metrics in each of the 6 domains that we talked about. And the tool can be used to track either individual progress or the progress of a collective group or grant portfolio. The levers of change are primarily qualitative. They identify and track steps for advancing PSE change across a group of diverse initiatives of different topics, and they help to balance understanding the individual efforts of the project or organization with the collective impact of the entire group. These levers are also helpful for reflecting on your progress to date. And lastly, the reflection and connection sessions are a fully qualitative tool and aim to increase collaboration and cross-sharing between stakeholders in a specific field or movement. The focus is on the collective progress, the gaps, and the wins, and less so on the individual activities of an initiative. Next slide, please. So this slide shows a comparison of the 3 tools that we've talked about with some key indicators that we identified. So as you can see, the PSE is ideal for medium to large groups that are working on PSE change. The participant burden is high, and the administration and data analysis burdens are relatively low. And there is also not much room to customize the tool. The levers of change are more helpful for small to medium groups with a moderate participant burden and a high administrative burden. There is also a moderate burden of data analysis, but a high degree of customization is possible. And lastly, the reflection and connection sessions are ideal for medium to large groups and have a low degree of participant burden, but they also have a high degree of administrative and analysis burden and a high degree of customization. We also wanted to compare and contrast how applicable or useful these tools would be in a variety of use cases. So as you can see on the slide, we believe that all 3 tools would be useful for grantee portfolio evaluation, for program assessment, and for collecting data for storytelling. Both the PSE and the reflection and connection sessions could also be really useful for coalition planning and for identifying gaps and opportunities in the field. And the levers of change and reflection connection sessions are also helpful for relationship building, like we talked about just a second ago. However, only the PSE provides quantitative metrics to capture PSE change of the 3 that we've talked about so far. But ultimately, the goals of these PSE change evaluation tools are to support initiatives in seeing the big picture and how their actions are contributing to those big goals and changes. Strong evaluation tools will support strategic thinking and inform decision-making for organizations and coalitions, and help collect actionable data that can be used for quality improvement and reporting on progress, while also helping to communicate the qualities and importance of PSE change to external stakeholders, so that ultimately PSE investments can continue long-term.
We have a quick question in the chat about the previous slide. In regards to small, medium, and large groups, what kind of range are we talking? What size would a small group be versus a large group?
Absolutely. So the reflection and connection sessions and the PSE the largest group that we've tested those with, as Ariel mentioned, is up to 80 grantees. And we expect that that could be scaled further for the PSE. For the reflection and connection session, it just kind of depends how many people you really want to engage, because you can kind of invite more and more people to be in that space. So it's really just about how many sessions you have the capacity to facilitate, essentially. But you could theoretically continue to scale those to as many conversations as you're willing to facilitate, or as you have the capacity to facilitate. For the levers of change, I'll let Hannah weigh in a bit more, but I know that that's typically a smaller group.
Yeah, I would say, as Stephanie said, some of it is like, how much administrative burden are you willing to take on? But the levers of change, because the nature is a bit like looking backwards and gathering logic models from a group and then doing that crosswalk, probably like 5 to 10 organizations or 5 to 10 initiatives max to do that comparison across. Otherwise, it's a bit too bespoke to, I think, make sense for just for the administrative and analysis burden of it. Yeah.
Thanks for that question. We'll dig into the last slide that we have just on some of the recommendations that we have. So as we've talked about, these tools have only been used in the projects that they've been designed for to date, but we feel strongly that there is potential for these three tools to be applied in a broad range of settings. So we thought about some of the recommendations, what we would tell somebody who is interested in utilizing these tools or in kind of developing their own PSE change evaluation methods. And we'd also love to hear your thoughts about whether these tools would be a good fit to support your work, or if there are any ways that they should be adapted, or if there are any gaps in other tools that would meet your needs. So I'll just put that thought out there as we think about wrap up and start preparing for breakout groups. So since we went through this process, I'll just share that we recommend asking your participants about their needs and goals for an assessment or evaluation and select the tools accordingly. So we mentioned during the reflection and connection sessions that participants really wanted that networking, but they also really prioritized having the low burden on participants. So we designed something that would meet their specific needs. We also recommend reflecting on your timeline and trying to balance burden and rigor based on if you're looking at a 1-year initiative and a 5-year initiative, and kind of what the asks are that you're making of the community and those that are engaged in your evaluation. We also recommend trying to gather both quantitative and qualitative data so that you can support communications with various audiences, depending on who you're sharing those results with. Some talking points may resonate more than others, so having both kind of in your back pocket is really helpful. And it may be necessary to utilize multiple evaluation assessment tools to achieve that both quantitative and qualitative goal. We also suggest that don't be afraid to modify the tools to meet the needs of your unique community and activities. Customization was one of the items that we compared kind of across the board. We recognize that each community, each initiative is going to be doing something unique and different. So we always recommend kind of thinking about what those broader needs are that are really your goal for the evaluation and adjust and tailor as needed. And lastly, we always recommend inviting participants to co-interpret the findings and to inform your dissemination activities, both in terms of making sure that your takeaways and your messages are really hitting those key points that are valued most by your community, and also to make sure that you have the buy-in for any dissemination that you're conducting. And with that, I think we'll pause for any other questions, and then we'll get ready to go into our discussion groups.
Okay, so we will have a chance to come back at the end with any other questions or thoughts. But we are going to split into breakout groups. So our general question, I mean, really, we just want conversation and hear what you guys have all been thinking about this. We'll drop these questions in the chat as well, but let's just get talking about what kind of work you all are doing on PSE change. Do these tools resonate with you and your needs in particular? Like, would you use them for evaluation? Would you use them for assessment and planning? Yeah, what are some different ways that you could incorporate them? What would support you in doing that? What do you see as potential barriers preventing you from doing PSE change and evaluating it? Okay, I will pass to Victoria to do magic. Hi, thanks. I hope that was a reasonable amount of time. We are hoping that people want to come back here and share a little feedback. My group closed out just as we were getting started talking about how essentially how to make community members care about this work. So even if you can get buy-in from other groups or you can get funding, it's so out there. It's so hard to like connect PSE change with what's happening in people's day-to-day lives. And so what is the communication that you use, or what can you show people? And curious to open that question to the group for continued discussion. How do you get community member buy-in for long-term PSE change projects? Feel free to join us. Come off mute. Catherine.
Thanks, Hannah. So for community health improvement work that I'm engaged in, for community participation and buy-in, I always go to the leaders in the community who have built relationships with as sort of those trusted messengers, and start with those folks to see if this resonates with them. Is this something that we should bring to the community? If so, can you help? So that's just the pathway I would go, I think. But it is, I think, where we struggle with community engagement is that it's hard to access community members. It's, people work all day. So if you're trying to get, reach out to folks and they're working during the day, and they can't connect at the time that you're working and connect, it's just, and people have busy lives. And so it's, working with community members who can be the community leaders and those who are embedded in the community, or community health workers who can help reach communities in ways that we can't, has been really helpful. So I hope that helps in some way.
And what are the communication tools that you use? What are the examples that you provide to bring people on board? Either
So
you or someone else. Yeah.
Sure. So I think in a variety of, it depends, I guess I would say, on what our end goal is. So if it's completing a survey as a way of communicating and getting feedback, we work really closely with community health workers from a local organization called the Ministerial Health Fellowship. If it is one-on-one interviewing, which I haven't done in quite some time, that would be the same pathway I would use. So I guess I feel like I'm sorry. I'm gonna tap someone else to answer that question, but
Thank you, Catherine.
Sure.
I can go. I think our community members respond to kind of, I'll say two things. One is a crisis, right? Like a thing that is happening that they are galvanized to stop from happening, or, rally around at a critical juncture, or a what we tend to do in the community building space, because that's not a good way to build community, right, is around one moment in time crisis, is to bring an evaluation of some sort that's already happened, an assessment, a report, and say, and kind of solicit their like solutioning of these needs assessments. So it's usually bringing out the needs assessments and having them work through a prioritization process, having them start talking about the assets in the community that can move the work forward, because we can get very needs focused and not and that doesn't keep people at the table. Like it'll bring people to the table once, but then they want to see something happen.
I have found that in terms of engaging community members, it works better if I'm engaging them in a way that feels like they have the power and they're the ones kind of driving the ship. If I'm asking them to fill out a survey, or like, okay, like, yeah, like give me like your experiences, give me your opinions, and then I'll take this to the state house, or I'll take this to the entity formerly known as DHCD, and we'll talk about it. Like that doesn't work. They might give it to me, but they're kind of checked out because it's not, they don't have anything to do with it. It's another yet another case of like somebody else making decisions about what's best for them and then like implementing them without their say. Um, but you know, if like I'm there to facilitate, for example, like, you know, going through the regulations on a voucher program in anticipation of the regs being open for comment, and like, you know, talking through like, okay, so like this is what this looks like when it's implemented. How does that affect your life? How does that, you know, work for you or not work for you? What would you like to see differently? And I'm not there giving suggestions. I'm just there like to facilitate them thinking about it. And then like we put together some recommendations together, and then I go with them to the meeting to present their recommendations, but they're the ones presenting, then you have real buy-in. Um, that unfortunately takes a lot more time and energy though. So it's not necessarily scalable.
Yeah. Other thoughts from the other breakout groups? Sharebacks? Okay. I know that we presented or anything else from the chat that I'm comments from the chat that I'm overlooking that Stephanie or Ariel want to bring in.
There was one question.
Your volume again, Ariel.
Sorry. There was one question earlier in the chat, right before we went to breakout groups, asking to hear examples of how grantees or participants have used these tools beyond reporting for their own learning, planning, decision making. That there, it looks like there's potential to that. Wondering if we have any success stories so far.
I don't think we're there yet with our success stories. We have a survey out right now, actually, with our Mass Chaff grantees, asking them that very question. I think a lot, just process wise, I think what we heard from a few groups is many people, many of the organizations uh, we're working with these tools. You all are like on the ground people. You are putting out fires every single day. You are saving lives. You are dealing with whatever the world throws your way. And it's very rare as a community-based organization to have that opportunity to sort of sit back and reflect and get into that big picture thinking. And these tools force you to do that, force people to do that. And from what we've heard, that's a positive thing that people like appreciate. Not that they appreciate being forced to do anything, but appreciate the opportunity to have that like, oh, wait a minute, where do I fit in this puzzle? What puzzle piece are we doing here as part of a bigger social justice movement around food insecurity or around a bigger movement about housing affordability in my state, in my region? And that the tools get you out of that day-to-day fire putting out to look at the bigger map. So I Stephanie and Ariel can help if we've heard any specific stories. I don't think we're there yet, but we have heard that feedback that it's sort of like a moment of meditation, a moment of like grounding and remembering where you are in the greater scheme of things. Yeah.
And also, I think this is highlighting again how like you all.
Your volume is also soft, Katie, I think.
Oh gosh. Okay.
Yes.
My AirPods
Is it?
died. So.
It's contagious.
Can you hear me now? No.
Okay-ish. But please go ahead. No, we heard you good enough. So keep trying. Oh, now I can't hear you at all. Got worse. Okay, in the chat. Any other questions or thoughts?
I could just build on that last question just a tiny bit more as well. In some of these discussion spaces, I can't think of any specific like stories to highlight, but I do feel like there's a lot of room to use these tools, one for that reflection, but also for planning ahead and thinking about kind of what are the gaps that we identified, whether that's kind of through the conversations you're having through the PSCRE and thinking about kind of your work in those different buckets and where you maybe aren't doing um, kind of some of those activities where you might want to be doing more, or kind of how you want to think about like strategically placing your efforts. But also through things like the reflection and connection sessions. Kind of where is that organizing happening? How are we bringing people together? How can we thinking about kind of coordinating our efforts or joining efforts? We heard some of this um, for things like policy change. Like we would love to get connected to other people that are working on similar policy change efforts as we are, so that we can coordinate our different activities, our different organizing events. So I do think that beyond kind of the measuring PSE change, there are those opportunities for kind of helping bring people together in your community, kind of using these not excuses, but using this as kind of the impetus to start those conversations beyond just your organization, or beyond just the work of your initiative or your project, and think about how you can kind of scale those activities. Oh, sorry, my voice went out.
But yeah, Stephanie, sort of using it as a tool to facilitate discussion with a coalition, using the various tools and the guiding questions and the frameworks, especially when you're in a coalition and everyone's doing different things, it sort of provides some framework and structure, and goalposts and guideposts to try to get where you want. We hope. That said, we know these tools are new. We know that it was a little overwhelming throwing all of that at you. And so we are really interested in keeping up this discussion and sort of having one-on-one conversations with any of you who would like to reach out to connect and just chat about the work that you're doing and how we know that, we didn't go deep on any of these. And so if you want some more examples of what the tools look like, we'd be happy to have some conversations. So I am going to share my screen once more on some ways to keep connected. I'll put these up for a minute. These are just a few QR codes you can click on if you want to with your phones. A link to some blog posts that we have if you want to learn more about the Massachusetts Community Health and Healthy Aging Funds. There are also additional CHTI trainings on policy systems and environmental change. And there's also the Root Cause Exchange, which is a great place to network and share resources and opportunities with other like-minded folks working in this area in Massachusetts. And then I will hop to the next slide. As I said, we are very interested in keeping talking about this. We are very good at measurement. We are not experts in all of the PSE change work or program work that you all are doing. So we would love to hear some more of your insights. So please feel free to reach out to me and set up a conversation. And then also some QR codes if you want to learn more about HRIA or again, the Massachusetts Community Health and Healthy Aging Funds. And I will, if that's enough time for people to get this information, I'll pass back to Katie or Victoria.
Hello. I think my AirPods charged up enough for me to finish out this last bit.
Awesome.
So yeah, just wrapping us up. First and foremost, thank you so much to our research and evaluation colleagues for sharing your expertise with us today. This training was jam-packed with food for thought about PSE change initiatives and how to measure them. So thank you so much. Victoria already dropped the link to the feedback survey into the chat. So we would really appreciate if you could take the last couple minutes of this session to fill those out. We have a slew of fabulous fun trainings coming up in the spring semester, starting with one in January, which is going to focus on responsible AI for community health work. You'll receive a email from us shortly when that registration goes live, and it's going to include some practical foundations for responsible AI and how to use it in community-based and local health department settings, as well as some core considerations before developing an AI policy for your organization. We're also going to have a bunch of others on asset-based planning and resiliency, navigating local policy to advance community change, some things about website pitfalls, what not to do and how to do it right if you're interested in upping your website game for your community-based organization. So keep your eyes out on the training calendar for all of those to come. And finally, if you have any sort of job postings or events or things you want us to spotlight in the CHTI newsletter and on our LinkedIn, please let us know so we can elevate that for you and get it out to the larger coalition community across Massachusetts and beyond. That is it from us. So enjoy your holiday season, stay cozy, and we hope that we see you all next month. We'll follow up with the recording and the slides that were shared today as well. That's it from me.